At this point, I think I should quickly introduce Chloe Hall, and I'll just start her presentation here. And I think Chloe almost gets the prize for the longest title, Spike Protein of SARS Cov-2 and its interactions with antibodies and receptors and the role of mutations. And I'd like to thank her supervisors for proposing and supervising the project. So we got Ricardo over here, Chris Malachek, and Lena. I'm sorry, I was trying to remember your name. So thank you for being here. And Chloe is doing a Bachelor of Science in Chemistry and Biochemistry, is that right? Very good.
Hello everyone, my name's Chloe Hall and I did the spike protein of SARS Cov and its interactions with antibodies and receptors and the role of mutations. So essentially my project was to visualize the spike protein and its interactions with two different receptors and an antibody. The two receptors were the ACE2 and the DPP4 receptor, and the antibody was the CV07250. So the expected outcomes were, from a teaching and learning perspective, were to give a scientifically sound and meaningful, informative model of the spike protein and give access to the general public. Hopefully this will reduce misinformation, as there is a lot on social media platforms these days. So hopefully people with access to this will actually understand the virus a bit more, and with the mutations and the primary receptors and other things that are going on with the virus. From a scientific perspective, the mutant models that were created remain stable throughout the simulation, so hopefully through more rigorous testing and analysing through GROMACS and PyMol and stuff like that, we can get a better understanding of the interactions of the mutant in comparison to the original RBD. So just give you a bit of background on the things I just talked about before. So the spike protein is made out of two subunits, S1 and S2. The focus for this project was the S1 subunit because it homes the RBD, which is responsible for its interactions with different receptors, like the ACE2 and antibodies, and is also responsible for recognition and binding to the host receptors. It's also covered in complex carbohydrates, which constitute for its cloaking and camouflage to evade the immune system. It also has an open and closed state. So in open state is when it recognizes that the ACE2 receptor is close by and it binds to it. And when it's in its closed state, it can't recognize any receptor that it wants to bind to. So it is basically inert and evading the immune system yet again. We also have the host receptors, the ACE2 host receptor, which is responsible for regulating a hormone called the ANG2. This controls inflammation and blood pressure, and an overproduction of ANG2 hormone can actually lead to acute respiratory distress syndrome, which is the leading cause of death synonymous with SARS-CoV-2. So it's obviously important to recognize and determine the binding mechanisms and thus the interactions to manufacture therapeutics that could competitively bind and inhibit the interactions that it has with its primary receptor. So we have the DPP4 receptor as well, which is actually just a proposed receptor due to a few reasons, such as people with diabetes, being hospitalized with more severe symptoms, high mortality rate, and the correlation of inhibiting this receptor and improved clinical outcome of patients with SARS. So obviously if something is observed to have an improved clinical outcome, you would want to focus and think about strategies toward maybe preventative therapeutic solutions involving this receptor, that stuff. So we also have a background on antibodies. So antibodies are the body's natural neutralizing agent. So scientists elucidate structures and interactions to monitor how antibodies competitively bind to RBDs and neutralize so the RBD is a spike protein, just reminding again. The extractions of these antibodies are important to find therapeutic solutions and guiding the vaccine design thing. So we have the mutations lastly, which are important to monitor as they change the way that the receptor binding domain actually binds to the ACE2 receptor and how antibodies can interact with the RBD as well and then inhibit it. So sometimes the mutations experienced by the RBD result in a decreasing affinity with the antibodies and an increased affinity with the ACE2 receptors, which aren't good for us. So why these particular receptors? Obviously ACE2 is the primary host receptor, TPP4 is a proposed, and antibodies are the body's natural neutralizing agent and one of the leading kind of studies that are used when designing vaccines and therapeutic solutions. So the workflow was we chose what host receptors and antibodies were important, especially when regarding where the RBD is interacting. There are so many receptors in the body, so obviously we want to choose the most important ones that actually interact with the RBD. So the next step was obtaining the PDV molecule files from the protein data bank and modifying these protein structures and coordinates using PyMol. Then visualize a static spike protein with host receptors and antibodies in MDV. And then there was two kind of paths from here. We created the mutant spike protein and then in Discovery Studios, and then produced a molecular dynamic simulation. And then we produced a molecular dynamic simulation of the RBD and ACE2 receptor using GROMACS. And then finally into MDV for visualization. So how do we do the static structure? So we had 4 PDB structures, one for the spike protein, one for the ACE2, one for the DPP4, and one for the antibody. And these were loaded into PyMol. So PDB is basically a database filled with structures of large biological molecules. And these have been empirically determined using different techniques such as X-ray crystallography and NMR spectroscopy, and a few more. And PyMol is software compatible with these PDB files that allows for easy modification of biological system and coordinate changes of the systems. So for the spike protein and all of the PDB files, they underwent a series of modifications to the chains and structure files to just remove any unnecessary molecules that might interfere with GROMACS and all those kind of things. And then altered the coordinates of all the things because the spike protein was basically the reference structure and everything else was in some other place in virtual 3D space, so we had to move them and change the coordinates so they're all sitting next to the spike protein. And then, so just a little bit about molecular dynamics. It's a simulative technique that allows viewers to visually analyze the movement of atoms, and it can, so you can observe the evolution of a biological system over a small time scale. So it uses 3 main components: force fields, energy minimization, and equilibration. These are used to kind of emulate a real-life scenario for experiments. Obviously, this is a virtual machine, so you want to make it as close to the real life as possible. So force fields estimate the energies associated with bonding, bonding and non-bonding. And then energy minimization basically just finds the arrangement of atoms in space where there's the lowest Gibbs energy and it's relaxed. So hopefully finding a structure that isn't too unrealistic if you put it into real life and would be very unlikely to exist. And then equilibration just fits the virtual system to the environment and real life experimental conditions like atmospheric pressure and room temperature or biological temperature. So how did I kind of incorporate molecular dynamics? So the RBDs that were made in the static structure were kind of exported as systems with their respective receptors and antibodies, and then they were subjected to GROMACS using Magnus supercomputer. And then obviously all the MD kind of components that I talked about in the previous slide were incorporated into this, and then I processed on VMD just to correct the coordinates because they move around sometimes in using GROMACS, and then I extracted the trajectories and isolated them from their solvents and then smoothed out the trajectories just to make it a little bit more visually appealing. And then for the mutant, in Discovery Studios, I changed the residues. I gathered empirical data and then changed the residues accordingly. And then they were minimized, and then the mutants were then subjected to GROMACS using Magnus again. And then the same post-processing kind of thing went on with correcting coordinates, extracting trajectories, and smoothing out trajectory. And then finally, we have all the 7 components ready for MDV, so we can visualize the interactions at the interface. So the secondary structures were all enabled. Having primary structures available was just a bit too much, and it kind of distracts from the interacting surface. So just did the amino acids present for the interacting amino acids that I could gather from research articles and stuff like that. And the final structure looks a little bit like this, or looks like this. And then last, oh my gosh. Carly, you didn't upload the version. Well, that's a bit awkward. Just like to acknowledge and thank all of my supervisors, Chris, Lena, and Ricardo sitting right here, and the Hive staff for helping me whenever I needed help. So, thank you very much.